Today we are going to talk about how ticagrelor inhibits platelet aggregation and reduces inflammatory burden more than clopidogrel in patients with stages 4 or 5 chronic kidney disease. Till now, no study has compared pharmacologic properties of ticagrelor and clopidogrel in non-dialysis patients with stage 4-5 chronic kidney disease. A double-blind randomized control trial was done to compare effects of ticagrelor and clopidogrel in 48 CKD patients with the primary outcome of ADP-induced platelet aggregation after 2 weeks of dual antiplatelet therapy. In a parallel arm, the effects of 2 weeks of ticagrelor plus aspirin on mean changes in ADP-induced platelet aggregation were compared, and markers of thromboinflammation among non-CKD controls with that of CKD in the ticagrelor arm were done. Coming to the results of the study, ticagrelor generated statistically lower ADP-induced platelet aggregation values post-treatment versus clopidogrel, and the inhibition percentage of ADP-induced platelet aggregation was greater with ticagrelor as compared to clopidogrel. No differences in mean changes in ADP-induced platelet aggregation between CKD-ticagrelor and control groups were observed. Ticagrelor dual antiplatelet therapy reduced levels of IL-1 alpha and IL-1 beta in CKD-ticagrelor and control groups, attenuated lowering of TNFα alpha and TRAIL levels in CKD-ticagrelor versus controls, and had global changes in correlation between various cytokines in a subgroup of CKD-ticagrelor subjects not on statins. Coming to the conclusion of the study, significant differences in platelet aggregation and anti-inflammatory properties between ticagrelor and clopidogrel-based dual antiplatelet therapy in non-dialysis people with stage 4-5 CKD were reported. These notable inflammatory responses suggest ticagrelor-based dual antiplatelet therapy might lower inflammatory burden of asymptomatic patients with stage 4 or 5 CKD.